This is such an important video. I really want you to hear this. I just got a question from a 39-year-old woman. Dr. Daccarett, I have all the perimenopause symptoms, but my lab test came back with an estradiol of 1,000 picograms per milliliter, and I'm told that I don't need it. One doctor told me to take DIM to lower the estrogen. Now, what is wrong with this? And what can we learn from this? Because this is actually really common. Now, during perimenopause, the ovaries stop producing estrogen and progesterone, and this starts around age 30. The brain starts to be like, oh my gosh, we don't have enough hormones. So it releases a hormone called FSH, or follicle stimulating hormone. FSH stimulates the ovaries to produce more hormones, estrogen and progesterone. The ovaries can produce a surge of estrogen every now and then, but they're failing. They're no longer working as well, and progesterone typically isn't made at all. And the estrogen that the ovaries are able to produce isn't consistent throughout the entire month. Sometimes you can just have a surge of estrogen. FSH is the lab test that we need to be using for women, not looking at absolute hormone levels. So in this case of this patient, her estradiol was 1,000, but her FSH was off the charts at 29. Okay, so anything higher than 9 is an indication that your ovaries are struggling to make hormones. And your brain is trying to stimulate the ovaries to make more hormones. In other words, she needed to start hormone therapy. Bad, but she was denied because the doctor looked only at the estrogen level, which was high, and didn't even know how to interpret the FSH. One value, a single value of estradiol, doesn't tell you what's happening the whole month, and it also doesn't tell you about progesterone and testosterone. It is just one point in time. An FSH, however, tells you what the brain is doing. How does the body feel? Is the body struggling to make hormones? Does the brain think that there is more, that it's trying to stimulate the ovaries to make more? If an FSH is elevated, the brain thinks that there's not enough hormone around all the time.